Howdy, my name is Mallory Johnson, and I'm a graduate student at Brown University. Welcome to our podcast. Today, we're excited to focus on COVID-19 vaccines, which are a hot topic of discussion right now. And we're glad that we're able to host this podcast just in time for National Public Health Week at the beginning of April. We're super excited to welcome Dr. Vin Gupta, who is currently quite a celebrity in the world of COVID-19. So, Dr. Gupta, would you mind sharing a little bit about yourself and your rise to prominence as a voice of reason during this pandemic?
Mallory, thank you. Thanks for having me and for those kind words. I'd say, as with to anybody listening right now, that everything happened organically. This is not a public perch I had planned on by any means, but I'm a trained pulmonologist and come from a health policy background and have a few different roles right now in life. And it, in some ways, just and I think hopefully this is instructive for all your listeners, that I just took advantage of opportunities as they arose. And so as a pulmonologist in health policy, but who continues to be clinically active, but then also has a few different roles in public health, I had established relationships with media. The University of Washington would routinely ask me to go and talk about issues that were pertinent to current events, whether it's vaping or air pollution, and now, of course, this pandemic or respiratory pandemic. And so I took advantage of the opportunity. And as somebody that's been in public service, I come from a former military background. For me, I view talking to the public using mass media as a service. Certainly some people use platforms in other ways. I try to just speak truth through the lens of data and science, especially now when I think people are scared. They're often at home. They don't know where to get the right information. And so whenever I do have a few minutes to speak to a large audience, I try to really key in on things that are actionable, that can keep people safe and provide anticipatory guidance. And that's what I try to do.
Thank you. Thank you so much. And again, it's so nice to have you join this podcast. I know you're crazy busy right now, so this time is much appreciated. So for the past few months, I've seen quite a bit of misinformation being spread around about the pandemic as a whole. And something that's currently trending are the myths and rumors that have been circulating about COVID-19 vaccines. I thought it would be interesting to have an expert such as yourself come in and tell us why these bits of misinformation may not have much of a foundation beyond conspiracy or maybe flat out incorrect. I have 5 common myths that I have seen across social media platforms, and I was hoping that you wouldn't mind telling the viewers why this information is indeed misinformation.
Sure.
So myth number 1 that I've seen kind of most commonly are a lot of people suggesting that COVID-19 vaccines aren't a vaccine and that they're gene therapy and they alter people's DNA.
So I've seen this as well, and nothing could be further from the truth. Basically, the Pfizer and Moderna vaccines, what they are, basically they're the type of vaccine, they're new technology that insert in your body, into your cells, a blueprint for your cells to actually make a part of the COVID-19 virus particle that we think is really the anchor by which the virus enters cells in your lungs and causes infection. So basically, these vaccines provide a genetic blueprint for your cells to make that protein, make a copy of it. And what they then do is say, okay, immune system, this is what we want you to recognize if you're ever exposed to COVID-19 in the environment. So they build up antibodies because they've made their own blueprint of that protein, that really critical part of the coronavirus particle. Antibodies get produced. That blueprint goes away. It gets put into sort of the human cell trash bin, and you're protected. Antibodies get produced that then, if you were to be exposed naturally to this virus after you get your 2-dose vaccine regimen, for example, if you get one of the Pfizer and Moderna shot, that you'll already have protective antibodies towards the part of that virus particle that we think is really key for for entry into lung cells. So that's what's happening here. In no way is this genetic material getting inserted into your own genetic material. In no way is it permanent. It does its job. It provides the blueprint. Your cells go to work, make a replica of that key part of this virus, and then basically it goes into the cell trash bin, and that's it. So there's definitely no sort of gene therapy involved here, and that is definitely the height or the peak of misinformation.
That was a fantastic answer. So myth number 2 that I've seen also quite a bit is that more people will die as a result of the negative side effects of the COVID-19 vaccines than would actually die from the virus.
Well, that's easy to counter. Now, at this point, tens of millions of people in the United States and hundreds of millions of people, 350 million people, have received at least one shot of the vaccine. Some have received at least 2 at this point. Serious side effects, whether they're related at all to the vaccine or not, are exceedingly rare. Less than 1 per 1 million individuals who get vaccinated end up developing, say, a serious allergic reaction. Even less develop anything that might be considered a fatal type event. And often, as we're seeing today, for example, this is Monday, March 15th, right now in the headlines, there's this concern that the AstraZeneca vaccine may cause blood clots. And I'm saddened to see that headline is out in the news, because it's exceptionally unlikely that this vaccine will do anything like that. But it is true that sometimes people develop blood clots. That's just a fact of life. That's not an uncommon thing to happen. And occasionally that might happen to people who also get the COVID-19 vaccine, but the two are not necessarily related. So it all goes to show here that we can really spend a lot of ink and a lot of time and a lot of attention getting anxious about these potential side effects that are fatal, or we can just look at the data as it is and recognize that severe allergic reactions to any of the vaccines are incredibly rare. Again, less than 1 in a million. They're very manageable if they do happen. Usually we can predict who's at greater risk of that, of actually experiencing a severe allergic reaction, because something like that may have happened in the past. And then number 2, I think we really need to be very cautious about making dramatic conclusions about, say, the AstraZeneca vaccine and it causing blood clots in a small proportion of people. It's extremely unlikely. A lot of people who get these vaccines right now are sick to begin with. They're older, they have pre-existing conditions. Stuff like this is going to happen, but it does not mean that it's because of the vaccine. And so we need to pause here, recognize that the only way out of this pandemic is for the entire world to achieve herd immunity, not just the United States. And we need every vaccine in our toolkit to get that job done here. And right now, I'm really concerned about the optics that are being appended to some vaccines versus others.
And myth number 3, the COVID-19 vaccine is not safe because it was rapidly developed and tested.
This is a common fear that politics or voodoo went into the making of this vaccine. How else could something get developed that's high quality in a 10-month time period? Well, here's the fact. The fact here is that no other vaccine has had every scientist, every elected official, every governing body singularly focused on this one priority in our entire lifetimes. Never has this occurred. So what this shows here is the potential and the possibilities of what we can achieve as humanity, as an entire kind of global community of people, what we can achieve if we all work together towards one singular goal, which was the development of an effective vaccine for COVID-19. You start removing bureaucratic hurdles, you fund this initiative the way it was funded, you get people to want to enroll in these vaccine trials the way they were because we were messaging on it and media was focusing on it, well, then we can develop any vaccine in a pretty consolidated period of time. People need to focus here that the reason why this happened so quickly is because we were all focused on one goal, and typically that doesn't happen when it comes to vaccine development. That's why it usually takes many years, because there's bureaucracy, because there's funding issues, because it's hard to enroll people to want to actually be a part of these studies. Here, none of those things were issues because everybody wanted a vaccine and everybody was committed to its development quickly.
Another fantastic answer. So We'll move on to myth number 4. Getting the COVID-19 vaccine means I can stop wearing my mask and taking coronavirus precautions.
I can understand why people want to do that. And here's the piece about vaccines that we all need to be clear on. Vaccination in the setting of receiving a COVID-19, getting vaccinated with a COVID-19 vaccine will keep you out of the hospital. All the vaccines are 100% effective in actually keeping people who receive them out of the hospital and obviously preventing deaths as a part of that. That's why you take a vaccine. You don't take a vaccine to prevent sniffles or body aches or mild infection. Who cares at the end of the day if you develop those things? I mean, like that is the whole point of vaccination. Otherwise, why would you want to feel injection site soreness and low grade temp for those 24 hours after you get a vaccine? It doesn't make sense. So I think to be clear here, vaccination prevents severe illness from COVID-19 and hospitalization. What we know it may not prevent is mild infection. It may not prevent being infected with a virus and passing it on to others who may not be vaccinated quite yet. So you could be a carrier of the virus still, and this phenomenon appears to be occurring in greater frequency in the setting of these variants, where, for example, we know the vaccines will still protect against severe illness even if you're infected with a variant, but these vaccines appear less effective in preventing this carrier state, this sort of asymptomatic infectious state where you can still pass the virus on to others, but you're still protected from the intensive care unit. It's weird for people to understand that dichotomy. Frankly, it's hard for me to wrap my head around that as well. How could you be protected from severe impacts, but you can't be protected from passing on a virus asymptomatically to somebody else? I don't know the answer to that, but I know it's possible, which is why we're saying until more people receive the vaccine, until we have reached herd immunity, 75 to 80% coverage, hopefully, and not only in the United States, but across the world, but at least as a first pass here in the US, that it's vital for you to continue to mask, distance, and be vigilant as you go about your day. And that by the end of June, hopefully, once we have enough coverage, we won't care if you're passing on this virus asymptomatically to other people, because then people will broadly be protected from ending up in the intensive care unit, even if they're, say, getting infected with a variant. So that's where we want to get. We want to get to the point that even if we're passing this virus on in our communities asymptomatically to each other, it doesn't matter. We won't notice it, or at worst, we'll have sniffles or body aches. That's where we really want to get to. And that's the goal here of this vaccination drive quickly.
Myth number 5, if somebody's already had COVID-19, they don't need to be vaccinated against it.
Oh, this is definitely wrong. What we know here, and Senator Ron Johnson and others are putting this out there and confusing people, and why they do these things, like why people with platforms do things like this, and I will never understand. But if you've been infected with COVID-19, if you've survived an initial illness with this virus, as long as your symptoms have resolved, you should get this vaccine. If you've just been recently diagnosed and you're still symptomatic, you should wait until your symptoms resolve. But once they have resolved, get the vaccine. And the reason why is twofold. Number one, we think the duration of protection after you've been naturally infected is quite small, maybe 3 months. You'll be protected from reinfection. But we really don't know the answer to that with any certainty. We know that protection from reinfection, or from at least severe infection with a vaccine, is much stronger and likely will last a lot longer. Number two, it does not appear that natural immunity to this virus, so you've been exposed, you've survived the virus 1 you have some degree of antibodies built up from this natural infection. We don't think that protects you against infection from the variants, especially the variant first identified in South Africa. It looks like individuals who've been exposed to the original version of the virus, who've been infected and survived that initial bout, when they've then been exposed to the variant first identified in South Africa, they got infected. And they, in some cases, got sick. It appears that vaccines will protect you from the worst impacts, again, of any severe, from the worst impacts of infection from any of these variants. So to summarize here, we do not know, we think that the duration of immunity, of protection from reinfection, from natural infection, is quite narrow, quite small, maybe on the order of a few months. So you're not protected for a year, for example. And we think the vaccines will give you that longer term protection. Number two, with these variants on the horizon, the vaccine provides greater protection against the variants than natural immunity. So that's the key piece here. That's why if you, again, survive this virus time once, you want to get that vaccine to ensure you survive it if you got exposed a second time.
So I just have a few questions from peers and from our viewers that they wanted addressed, and they were excited for the chance to ask you. And so my first question would be regarding the different vaccines. And this person asked, how can you effectively measure the difference between all three vaccines, especially considering some vaccine trials were performed before the variants?
It's a great point. The person that asked this question is keying in on the big issue here that I think has gotten too much oxygen in the media, which is to say that Pfizer or Moderna is somehow better than the Johnson & Johnson vaccine. No, that's false. All these vaccines are excellent at keeping you out of the hospital. Frankly, they're 100% in people that got these vaccines in the phase 3 clinical trials. Everybody that got Pfizer, Moderna, or Johnson & Johnson, you know, the metric that mattered, 100% of all those recipients, regardless of brand, stayed out of the hospital. All of them, none of them died. So 100% effective in keeping you out of the hospital, 100% effective in preventing deaths. That's all that matters. The effectiveness numbers are confusing to everybody. And in part, you can't compare one set of clinical trial data to another, which is what the inherent essence of this question, which is great. Clinical trials are representative of the time in which it occurred, the geography in which it occurred, the realities that existed at that point in time, the variants that existed at that point in time, and the people that were enrolled. So you can't compare a clinical trial from Pfizer to the one that was done by Johnson & Johnson. Johnson & Johnson was constituted at least 8 countries. It was done when these variants were circulating. The Pfizer and Moderna phase 3 trials were done at an earlier time point, much more narrow geographic catchment. And so how can we possibly say, yes, the Pfizer and Moderna vaccine with confidence is way better than the Johnson & Johnson vaccine, cite these numbers as though they are absolute truths? No. What matters here is who's getting hospitalized amongst those that get vaccinated, who's dying amongst those that get vaccinated. And the truth here is all these vaccines are doing the same thing excellently. They're keeping people out of the hospital, they're keeping people from dying, and that's all that matters.
Thank you. And our last question is, what are people's next steps when they receive the vaccine and it's been 2 weeks? What will life look like?
You know, at an individual level, we're all asking everybody to still remain vigilant in public. But of course, we need to provide some carrots and some incentives for people to want to get vaccinated. And so you're seeing the CDC just came out with guidance that you could have other vaccinated individuals in your life who you may be friends with come over for an unmasked dinner or get together. And that you can begin to see if you're an older individual and have grandchildren and they live nearby, you can go see them. Understanding that there's still this risk of potential asymptomatic transmission, but that if you're older and you're vaccinated and you're passing it on to younger family members, the chances that they are going to get sick if they're unvaccinated and require hospitalization is quite less. But again, that's sort of the implication of all these guidelines here is that there's still a risk to people, but we have to manage the head with the heart here. And that's why you're seeing more liberalization of policies. And you're going to see in the coming months, as more people get vaccinated and more of our vulnerable communities are protected, guidance on travel, on how to safely go about planning a vacation again. That's going to happen soon. I know some people criticize the CDC for not being more aggressive in their guidance, but I think they're doing the right thing by being cautious as we ramp up vaccines. And it's going to change once vaccines are more broadly available in more people's arms.
And as a final note, if you're interested, I was hoping you could leave us with a take-home message about these vaccines. So if there
Yeah.
was one thing that you could tell people that were hesitant about getting vaccinated against COVID-19, what would you tell them?
Getting the vaccine is your only way to regaining normal life again. And those normalcy means the same thing for all of us. That means being able to have the freedoms to do the things we want broadly, travel without restrictions, being able to enjoy a normal economy again. There are certain things you could potentially do as an individual, and you'll say, well, you know what? I don't need to take a vaccine because I'm going to do what I want to do and exercise, one's own personal liberties. The fact here is that unless we all get vaccinated when eligible, there will be constraints on our life, whether we like them or not. And we're not going to have full normalization. So there will always be an impact of this pandemic if we don't rid it on all of us. So yes, there's certain things you can do at the individual level where you can try to cocoon yourself and feel like, well, you're going to do what you want to do. But it's critical for the people to recognize that unless everybody who's eligible gets this vaccine when they're ready, when their time's called, if they choose not to do it, all we're doing is delaying full normalcy. A full economy revving up again, the ability to enjoy the things that we've all long wanted to enjoy after 14 months away. There will be limitations that will be imposed on us until we all reach herd immunity, and so that puts the onus on all of us, not just on some of us.
Great message. Great message. Couldn't have been better. But it does look like we are out of time. But thank you so much, Dr. Gupta, once again, for joining us on this podcast and for dedicating yourself to the public health efforts around the country during this trying time. And even before that, and you've made such an impact, and we need more voices like yours that are working against this misinformation on a daily basis. We wish you the best. And again, thank you for your time and for joining us on this podcast. Have a fantastic day and stay safe out there.
You as well, Mallory. Very nice to see you, and thank you for the invitation.
Of course.